I keep seeing the same argument come up for fun scrubs and banning fun scrubs. It's that you can't tell who is who, right? You can't really tell who's who, right? Because you can't tell who a nurse is, who an AIN is, who an EN is, blah, blah, blah. Everyone wears the same shit in theatres. Everyone wears the same shit in theatres. You're all wearing the same blue scrubs. Even the wardsmen and the wardswomen are wearing the fucking theatre scrubs, aren't they? Pretty sure you can tell who the surgeon is. If someone isn't telling you what their role is when everyone's in fun scrubs, that's not a fun scrubs issue. That is a person issue. That's a them issue, a management issue, that they need to be managed properly. They're working outside their scope. You know? It's not a fun scrub issue. Stop bringing up this argument. It's silly. It doesn't, it's a moot point. Okay? And also, I feel like in healthcare, in my experience in healthcare, the uniform policy has always been the strictest for nurses. And like doctors, in my experience, again, I haven't worked everywhere, okay? So don't come for me. It's always been very relaxed about what they wear, even in emergency. It's always been relaxed. Doesn't matter what brand they are, doesn't matter, like, it can be different shades of the color that they're meant to wear. Like, they're meant to wear a certain color, but also it's very relaxed. Very relaxed. There's no one, like, policing it, even though they're under the same umbrella of health, right? I don't know what it's like for allied health. I do know that they have a uniform. I'm not sure what it's like for other departments, but I've always found that quite interesting, that divide between the doctors and the nurses, especially, like, so strict on our uniform. You can wear whatever you want, Doug. You can wear whatever you want. And maybe that's just a me thing. Maybe I'm reading into it a little bit too much, but that's just been my observation. I know that, like, all the cleaners and the wards people all have the same uniforms, and whether it's strict for them, I'm not 100% sure. Maybe I should start asking to see what their experience is. You know, and a lot of people have been commenting, oh, where do we draw the line? We draw the line to Fun Scrub Friday. There's a line. There's one day of fun uniform. Fun Scrub Friday. And, like, there's literal studies to show now that they have a positive effect on patients' experiences in hospitals. So there's a line. I don't think we're crossing it. I don't think we're asking for anything insane. I think we're just saying, hey, we like these on Fridays. But yeah, stop bringing up these, to me, they're just silly arguments to be making.